Hey, this is Dr. Clay Williams with the University of Texas Health East Texas Medical Center here in Tyler, Texas. I wanted to briefly discuss incontinence, which is basically a so-called leaky bladder, more common in women than men. And there's different ways to describe incontinence, but the easiest way and the most common way that urologists approach it in trying to discuss it with patients is you can have urgency frequency incontinence, where where almost every bathroom is. The urge gets you, you've got to go, or you're going to potentially leak on yourself. That's typically a neurologic issue with the bladder. First line treatment is dietary modifications, etc., fluid restriction maybe, and then medications to try to block that nerve impulse to stop the bladder from squeezing. And there's other treatments you can do also. You can find that on other videos like InterStim and Botox injections. But stress incontinence means not mental stress, but it's stress on the bladder. So coughing, sneezing, laughing, jumping, exercise, and whatnot. And that's a surgical issue. Typically, the urethra, and the bladder's back here. The bladder's not the issue. The urethra, the urinary channel, when you cough or sneeze or whatever, you tend to do this. The urethra is hypermobile. So we want to do a small surgical procedure to place some sort of synthetic mesh or sling to slightly lift up the urethra. Now, let's talk about that. There's been a lot of discussion over many years ago about polypropylene mesh or slings. And the issue with that really was not with the sling, but it was the issue of using large pieces from multiple companies that are all trying to get on this, on the train. And that was to lift the bladder. And that's where all the mesh scare and complications and all those products are off. But there was never an issue with polypropylene mesh used for a urethral suspension. And these are called TVTs or TOTs, transvaginal tape, transobturator tape, retropubic slings, urethropexy. And the sling that I use is Solyx, S-O-L-Y-X, from Boston Scientific. I've used it for many years and have had excellent results. Now, most retropubic slings or transobturator, whatever you want to call it, requires a piece of mesh that's extremely long, and it requires multiple incisions. Either you have to pop behind the pubic bone, or you have to go through the inner thigh and then cut the redundancy off. It can be very painful. And the recovery is typically, 6 to 8 weeks, no sexual intercourse, no heavy lifting, no exercising, nothing. And that's part of the scare of why a lot of women don't seek surgery for the stress incontinence, either because they remember or someone tells them something about some sort of mesh, or they were outlawed or something, which is not true, or they don't like the idea of no sexual intercourse, pelvic rest for 6 to 8 weeks. They can't exercise, and so they allow their incontinence to get to a point where it's a lot worse than it should be, and they should have had it fixed a long time ago. So the surgery I use with the Solyx sling, I call it the minimally invasive single incision sling, or the MISIS, M-I-S-I-S, kind of catchy, right? And so it literally is a single incision, about 1 centimeter in length, inside the vagina. There's no punctures, no holes, there's nothing else anywhere in the body. And the sling I put in is no bigger than this, very small, and I can place it somewhere between 4 to 8 minutes. The typical slings, the real long ones, at best it takes someone 45 minutes to do it. The way I do it, it takes, like I said, 4 to 8 minutes. It's outpatient surgery. 1 week recovery, not 6, not 8 weeks, 1 week recovery. Most of my ladies get back to sexual intercourse, exercising, everything, 1 week. And we do it minimally invasive, so it's under propofol sedation. So it's not even general anesthesia with it. Endotracheal tube down, you don't wake up with all the narcotic and gas inhalation. Hangover, you basically have propofol, the same milky white chemical that is placed into your arm, and as soon as it hits your vein, you go to sleep. It's what they do most colonoscopies with. It's just a light sedation, so you wake up feeling like you just had a really good sleep. So please look me up at rclaywilliamsdo.com, and on that website you can read more about the MISIS technique, and please reach out if you have any questions. I'd love to see you as a consultation. and see if this is an appropriate procedure for you. Hope you have a great day.